researchers have used AI to translate brain scans into text.
But one giant benefit could be changes in medical care. AI has been called medicine's biggest moment since antibiotics.
And one of the specific areas of medicine that could significantly benefit from AI is cancer care.
Oncology is really the perfect storm for AI because you have very large databases, you have long history of patient data, so you have the ability to improve not only the screening and diagnostic, but also make more personalized outcome-based treatment decisions.
So today you will learn about how AI can help us improve cancer care, focusing specifically on external radiotherapy, because frankly, that's the field that I work and do my research in. You will also see how AI can be used to tailor the radiotherapy care for each individual patient, save limited resources, and deliver more precise and faster treatments than ever before. So, let's start.
The early diagnosis meant that Barbara needed shorter and less invasive treatment. She told me without AI, her tumour might not have been spotted for another 3 years at her next routine scan, by which point it would have been a lot bigger and might have spread.
It's just so easy, there's no extra appointment or anything. So it's minimal compared to what it could be.
Now, to fully appreciate the significant impact of AI, you have to understand the struggle with the traditional radiotherapy cancer care. In other words, our life before AI. And if you don't know what radiotherapy is, it's a treatment technique that uses high-energy radiation to target and destroy cancer cells in the body, which makes it a highly complex procedure that requires high precision, advanced machines, continuous research, and collaboration between many medical experts. Now, I thought for you to understand what traditional radiotherapy might look like, I wanted to give you an example of what cancer patients at my clinic in Lund, Sweden used to experience during their treatment journey before AI. By the way, this traditional workflow is still being used in many clinics around the world that haven't integrated AI into their workflow. So the journey starts with the patient starting their journey by meeting with an oncologist to discuss treatment options and learn more about their diagnosis. And after that, the patient proceeds to take CT or MRI scans, because we need these scans to precisely locate the cancer while checking what critical organs are surrounding the cancer. In the next step, these scans are used to precisely delineate the tumor and surrounding organs that we need to protect them from radiation, or at least minimize their exposure to radiation as much as possible. Next, these delineated organs together with the CT scans are used for treatment planning. In this step, we determine how much radiation to deliver to the patient and where to focus it. The goal is to maximize the dose to the tumor while minimizing the dose to the healthy organs around the tumor. Now, once the treatment plan is controlled and approved by medical physicists and oncologists, now it's the time to deliver the treatment. However, since we are talking about treatment, one of the biggest challenges that could occur during the course of treatment are changes in the patient's anatomy. These changes could be a shift in the tumor size, weight gain or weight loss, or movement and volume changes in the healthy organs around the tumor. Now, sometimes the anatomical changes can be so significant that it leads us to pause the current treatment and have the patient go through the traditional workflow again to create a new treatment plan based on the new anatomy. This process, as you might guess, requires a lot of time, clinical resources, and can be uncomfortable for the patient. Okay, so at this point you might be wondering, what about AI? How and where can you use it to improve this traditional workflow? Well, I'm glad you asked. So let's jump into all the exciting changes that AI is making today and revolutionizing this traditional cancer care. Now, this is a map of some of the important key areas that AI is revolutionizing today. And to be honest, each one of these areas deserves its own video. But for now, I will give you a brief introduction to each one of them and maybe dive deeper in the future. Alright, so starting with using AI to create synthetic images. Today, with the help of AI, we are able to convert very easily between different imaging modalities. Like for example, converting between MRI and CT images. And why you should be amazed about that is because we can have a patient take an MRI image and then use AI to create a synthetic CT scan or an artificial version of what a real CT scan would look like for that patient. This synthetic CT can now be used just like a regular CT, but without exposing the patient to any X-ray radiation. Besides that, the MRI image in itself offers much better contrast than CT images, which allow the doctors to easily identify and locate the cancer while also reducing uncertainties in their workflow. The second area is using AI for image processing. In this application, AI can enable us to save a lot of time during MRI, CT, or cone beam CT scans. For example, here in Lund, we are using AI to cut the needed MRI scan time by nearly 40%, without reducing the quality of our medical images. This means that we can improve the comfort for the patients, but also offer more MRI scans to more patients that also need it. And the beauty here is that we did this not by buying multiple and newer MRI scans, but by rather using AI software. The next area that AI is transforming is image analysis. In this area, AI can analyze the medical images to detect, locate, and diagnose cancer earlier and faster than before. And as you might imagine, this can have a huge impact on the patient's lives, because finding cancer early gives them a much higher chance of survival compared to late detection. Some important examples of that we are seeing today in the literature and hearing about in prospective studies is using AI to detect breast and lung cancers at an early stage. All right, moving on to the next topic, which is organ delineation. This area used to be one of the most labor-intensive to the oncologist before AI, since they had to delineate every region where the cancer is located, and even what healthy organs are located around the target that we need to spare from radiation during treatment. Just to give you an example of that, in certain patients, like head and neck cancer patients, the oncologists have to delineate more than 40 structures per patient, and at the same time, not miss parts of the tumor. In this area, AI is typically applied either on a CT or an MRI image, and it generates a set of structures that the oncologist needed for this specific patient. These AI models can now help the oncologist to cut the time needed to delineate these structures significantly.
We've seen general time saving using these contours that is significant enough to justify its continued use. This has changed the workflow for these patients somewhat, where our dosimetrists now have a controlling and adjusting role rather than doing all manual contours. So our experience so far is that the quality of the final contours are largely the same, but with slightly improved consistency.
All right, now we'll reach the point where we'll talk about some of my personal favorite AI applications, starting with automatic treatment planning. With the help of AI, we can now automatically generate the best radiotherapy treatment plan faster than before, entirely based on the patient's unique and individual anatomy. And this is how it works. The model usually takes in either a CT image or a synthetic CT image generated using AI from an MRI image. This image information is then combined with the delineated organs, either generated by AI or by doctors. Then fuse this information together and generate the best treatment plan based on the patient's anatomy and the oncologist's prescription. And that's it. There is no need for the dosimetrist and medical physicist to create and investigate different and multiple treatment plans anymore. They can instead use their time and knowledge to create more treatment plans for more patients. The next area is one of the hottest topics right now in radiotherapy, the area of adaptive radiotherapy. The reason why this area is getting so much popularity is because it combines many of the AI applications that I mentioned previously into one major impactful area. This area is impactful and important because it aims to adapt the radiotherapy treatment based on the daily changes of the patient's anatomy, like the changes in the location or volume of the tumor and healthy organs that are surrounding the tumor. The adaptive radiotherapy technique can be divided into two areas, an offline and an online area. In this video, we will focus especially on the offline part because it can be performed on most treatment machines without the need to buy a dedicated machine for this treatment technique. As I mentioned before, a patient's anatomy can change during treatment, sometimes deviating so much from the original CT scan that it might lead us to rescan the patient and replan the original treatment plan. Now, thankfully, with the help of AI, we can make this process much faster, since the AI can adapt the treatment based on the changes in the patient's anatomy while also taking into account the originally prescribed treatment plan. By the way, in case you're wondering how do we know that the patient's anatomy is different today than before, well, the answer is because we take X-ray images, like cone beam CT images, before we deliver the radiation to the patient, to check if the patient is positioned correctly and if there are any anatomical changes that happened in the treatment region. Alright, so now you know a bit about CBCTs. This is how AI can help us with offline adaptive radiotherapy. The AI takes the CBCT image as input. It will then process it, improve its quality, and make it look like a CT scan. Then import and update all the delineated organs that were used in the original plans. And finally, recalculate the treatment plan on the synthetic CT to determine, based on data, if the patient needs an updated treatment plan. Alright, moving on to the last but definitely not the least area is using AI to assist in clinical decision making. And this area is close to my heart because it actually falls within my current PhD research. The idea here is to use AI on medical images and clinical data to learn things about our patients that can be used to improve their cancer care or the cancer care for future patients.
Artificial intelligence have the capacity actually to understand and interpret high-dimensional data, and this is something very important in healthcare, like imaging, genomics, pathomics, clinical data. So we might be able to find invisible to the human eye correlations that could help us to better understand this and better choose the optimal treatment for every patient.
Now, of course, this is still a fresh research area, and I'm super excited to see what AI can also contribute with in the future. So to summarize how AI is impacting the cancer care within radiotherapy today, we have to mention two major bullet points. The first one is that we can have faster and efficient cancer care, which means that we potentially can treat more patients than before without compromising the quality of the cancer care. The second major point is that AI is also helping us to reduce the effect of growing global problems within cancer care, which is also known as the shortage of medical staff in cancer care. With the help of AI technologies, we can now assist and reduce the workload on our clinical experts and free up time that they can also invest in resting and research. That could ultimately help us reduce the risk of burnout and medical errors within the field of healthcare. So here it's safe to say that the benefits of AI are not only limited to the patients, but it also seems to be benefiting the medical staff that is using it. So by now, I hope that you feel inspired by how AI is improving cancer care and allowing us to treat cancer patients better than before. Thank you so much for watching, and I hope that you learned something new today. And don't hesitate to reach out if you have any questions. Bye.